Hi everyone, I'm Tanya, a public health nurse here in the Philippines. The Provincial Health Office and the World Health Organization asked Unleashed to release more advocacies regarding COVID-19, especially now that a new variant of COVID-19 that is more contagious has been recently discovered. So let us start the COVID-19 series by listening to what our friends from other parts of the world has to say regarding the pandemic.
Hello guys, my name is Mary.
And I'm Alex
And I'm Nick.
from Canada. Canada.
I'm an OR nurse at a community hospital.
I'm working construction.
And I'm a schoolmate.
Schoolmate?
COVID cases has been going up every day since, and we actually are on a provincial lockdown right now for 28 days. Only essential businesses are open. No malls, no dining restaurants.
Also, it's been pretty hard since we're not allowed to gather from one household to another. So we didn't really get to properly celebrate the Christmas and New Year as the complete family with all the family members.
As for work, we have been canceling surgeries because there are no beds for patients. COVID patients are taking all the beds and it's very worrisome. As for you guys, it's not too late. If you only follow the rules, you follow the public health protocols, if you do your part, we can prevent the spread.
Wear a mask or a face shield. If it's too hot in there, then you just put your face shield. You cannot touch anything with your hand, and you don't touch with your mask or your face shield. Only parents can touch stuff.
But what do you do if your hands are dirty?
You wash it with soap and water.
And you don't stay close to other people.
Have to stay so far.
So far, 6 feet.
Yeah.
6 feet away. Yeah? Good job.
Thank you for advice.
Bye.
Hello po sa inyong lahat. Sana po ay nasa mabuti po kayong kalagayan ngayong bagong taon. Ako po si Michael. Nirahan po ko ngayon dito sa Canada. Isa po akong RPN ngayon sa kasalukuyan at nagtrabaho po ako sa isang eye clinic. Pero bago po ako nagtrabaho sa trabaho ko na ito, nagtrabaho muna po ako sa isang long-term care facility. At nakita ko po kung gaano naapektuhan ng pamilya, lalo ng mga matanda sa naming pasyente, sabagkat hindi nila nakikita at nakakausap man lang ang kanilang mga mahal sa buhay. Before kami po mag-start ng work, in-screen po kami. Lagi tinatanong sa amin kung meron ba kaming sintomas ng COVID-19 like fever, nakitang lalamunan, ubo. Tinatanong po kami kung bisita ba kami sa ibang mga pasilidad kung saan na-expose po kami sa virus na ito. Bago nga po kami masok sa aming unit, kami po ay nakasuot na ng aming PPE. Every week po kami sinaswab para lang po ma-check kung isa po sa amin ay na-expose sa virus na ito. At yun nga, noong December, tumawag po ako sa isang trabaho ko doon at pagpatuloy po nila yung pag-usap sa kanila ng every week. Sabagkat tumaas po ang mga kaso ulit sa Ontario at nagkaroon mo kami ng second lockdown. Yun nga, gayon pa man, kahit na wala na ako sa trabaho na yun, abdom ko pa din sa bagong trabaho ngayon kung gaano kaseryoso ang sakit na ito. Kaming lahat sa clinic ay nakasuot ng PPE, parating nang naghugas ng kamay, magamit ng hand sanitizer at mga antibacterial na sabon. Bago ko naming harap ang sa personal aming mga pasyente, sila ay pinapayuhan namin na tumawag o mag-email sa aming clinic kung saan sila ay screen kung may sintomas ng COVID-19. Lahat po ng tao dito sa amin ay seryoso ang sakit na ito. Mostly po ng tao ay sumusunod sa mga protocol na in-impose ng gobyerno para maiwasan ang pagkalat at pagdami ng kaso dito. Hindi po biro ang sakit na ito. Kailangan po nating mag-ingat lahat para sa mga mahal natin sa buhay, para po sa mga tao hindi kayang protektahan ang kanilang mga sarili. Sana po ay magtulungan tayo para mabawakasan na ang pandemyang ito. Nang sa gayon ay muli po tayo makabalik sa dating pamumuhay kung saan pwedeng yakapin at agkan ang ating mga mahal sa buhay. Salamat po.
Hi everyone, my name is Zarina. I'm a registered nurse working here in Australia for the past 7 years. I have over 10 years of nursing experience. So I'm based in Sydney, in New South Wales. So far, I have to say, for this country, we have been very blessed in how COVID has affected the population. Steps na ginagawa ng government are quite methodical. They are quite transparent in how they go about doing things. Although Hindi naman palagi tama kung ilalabas nilang plano. Once na marirealize nila na ay mali pala, they own up to it, then they revise. They try to get feedback on what works and what doesn't work, and then they improve it. We have instituted lockdowns from different states. They listen to scientific experts. They base their plans on sound medical advice and scientific research. Hindi lang dahil kung ano yung nabasa nila sa isang newspaper, makalat na balita, di sila basta-basta nakikinig doon. So Australians generally we like to do our own things our way, like how we have dealt with coming up with a vaccine. Hindi lang US or China or UK ang nagde-develop ng sariling vaccine, pati ang Australia. In terms of securing vaccine supplies for Australians in general, the government has been really good in putting their hands up first and being the first in line to secure the Pfizer vaccine and even the AstraZeneca version, aside from the one that we're developing within our own shores. As of today, January 6, 2021, they've secured 10 million doses of the Pfizer vaccine, and I believe there's another 50 million doses secured for the AstraZeneca version. Considering that there's about 24 odd million people, a population in Australia, that is quite a lot of vaccines secured. The plan is the vaccine is going to be given multiple times over an extended period of time. Our government is trying to make sure that we have enough to administer to each and every one of us once they're able to roll out the distribution. And also with rolling out the vaccine, they have been very transparent in who will be getting the vaccine. They do not prioritize politicians or certain rich influential people. They make sure that frontline workers, those of the population which are deemed to be at high risk, get the vaccine first. That way, I have to admire the Australians for their egalitarianism. So, pantay-pantay lahat, regardless of saan ka galing, paano ka pinanganak, at kung ano-ano pa. Yung impact ng COVID-19 sa Australia, kahit na hindi namin nadadama masyado, it's still quite shocking. Ang difference lang is that our politicians have been quick to act, considering first world Western country that doesn't believe in wearing masks or lockdowns, but in the end, when they see it is actually effective, they don't see it as a political stand, and they actually do believe in the science. Kung kailangan gawin mag-mask, they enforce it. I-explain nila sa mga tao bakit kailangan, hindi gaya sa ibang Western countries na hindi mandatory ang masks. They politicize it and make it something about your beliefs as a person rather than just being about your health. In many ways, yung pandemic na ito, para sa aming mga Pilipino, alam naman natin ang pambansang occupation nursing. Hindi namin talaga naramdaman yung quarantine, stay at home, work from home. Hindi masyadong naapektuhan yung work nung kasagsagan ng pandemic. Mga loved ones, hindi mo maiiwasang isipin, lalo na kung malayo ka, tapos ikaw nagtatrabaho ka dito. Tapos yung pamilya mo, hindi mo maalagaan, hindi mo makita. Even more so, ngayong pandemic. Nararamdaman na lang lahat. Doesn't matter if you're a nurse, domestic helper, an accountant abroad, bakasyonista. If you happen to be abroad, you're stranded somewhere, you can't go home to your family. Physically, you can't be with them. And you find out na they're sick, hindi mo ma-describe sa kahit kanino kung ano yung nararamdaman mo, kung anong klaseng sakit, kung hindi mo sila matulungan. Awa pa rin ng Diyos. Para sa ating mga kababayan, pinapalad tayo na healthy and alive and happy pa rin ang ating mga loved ones. Pagpatuloy natin na alagaan sila at kausapin sila every day. Make sure that you tell them that you love them. Sa atin na nawalan na ng loved ones sa pandemic, I'm really sorry. And I want to say you have my fullest support and my sympathy. I know na hindi madali yung pinagdaanan mo, pero tandaan mo yung loved one mo. Kung na-hospital siya dahil sa pandemic na ito, may nurse, may healthcare worker na kasama siya Sa huling moments ng buhay niya, pagdarasal ko na hindi siya mag-isa kung pumamaw na siya. It's hard not to get emotional. Hits too close to home. Para sa ating lahat, we're still continuing the fight. Nung una, denial tayo. Kailan ba natin nadaanan ng denial? Hindi yan darating sa atin, nasa China lang siya. Hindi natin kailangan mag-quarantine. Wala pa naman sa atin eh. Simpleng virus lang yan. It's just a cold. Bakit kasi kailangan mag-mask? Bakit kasi kailangan maghugas ng kamay? Nagugas naman ako ng kamay kaninang umaga ha. Sino ka ba para sabihan ako na mag-quarantine ako? Kilala mo ba kung sino ang nanay ko? Kung sino ang ganito? Sa tingin niyo po ba may kinikilala ang virus? Kahit gaano pa kadaming bilyong pera ang itapon mo sa mukha ng virus, didikitan lang ng virus yan. At the end of the day, it makes us equal. Walang pinipili ang virus.
Hello. First, I would like to apologize first for my appearance. I look so haggard. I just got off from a 16-hour shift. And unfortunately, most nurses are working long hours because of COVID surge. Okay, so my name is Jennifer, and I am the manager for dialysis here at Mountain View Hospital. I've been a nurse for 3 years now, and what can I say? I love being a nurse. I love my job. It is very challenging, very risky, especially now with COVID pandemic. But at the same time, it is very rewarding. It gives us a lot of privileges, and one of them is helping other people. And I believe that it is one of the best things being a nurse. Okay, so I was asked, what can I say about COVID? COVID is real. It is really real. If you could see our emergency department hallways, they're full of COVID patients. Unfortunately, we cannot provide them a room because hospitals are packed with sick people. Initially, COVID patients were the older people, the senior ones, but we are seeing younger and younger people now, ages 20 to 50-year-old. It is saddening, it is depressing because they're young and they don't have any history of past illnesses and they got the COVID virus. But we can do something. We can do a lot of things actually if we follow the CDC guidelines, if we follow our government protocol regarding COVID. I wear mask for you. You wear mask for me, implementing social distancing, and also getting the vaccine. Vaccine is out now for COVID, and most frontliners are getting the vaccine. In fact, I just got mine this morning, and my next dose, my second dose, will be next month, and I am looking forward to that. God be with us all.
Hi everyone, good afternoon. It's Sunday here in the United Kingdom at ngayon ay mag-grocery ako at part ng health protocol dito ay we should always wear mask kapag lumabas. Tara, samahan niyo ako. Ngayon, nandito tayo sa atin. Tara, pasok! Kailangan po nating pumila para ma-maintain ang social distancing. Hi everyone, I am Mark Anthony Ragasa, a hematology clinical nurse specialist in St. George's Hospital here in London, United Kingdom. I have been working as a nurse for almost 6 years now. The first case of coronavirus was detected in Wuhan, China last November 2019. It was not long until the number of cases rose and inadvertently the number of deaths. The spread of the virus was too quick that it was declared as pandemic in March 2020. The world was alarmed, worried, and frightened because of the uncertainties the virus presents. Its transmission was elevated The severity differ from one nation to another, and several studies were conducted to scrutinize the contributory factor in acquiring the said virus, and over millions of people have lost their lives. Every nation implemented different rules and regulations to protect both its people and the economy. Here in the United Kingdom, we initially had lockdown that eventually led to the reduction of its cases. The lockdown, however, produced negative effects on people's mental health. This is something I've experienced firsthand. The feeling of loneliness, the feeling of isolation. Homesickness can be cured by a bag or flight back to the Philippines, but for now, this is not possible. When we thought that this would be over soon, we were wrong. The United Kingdom reported a new variant that is causing the sharp rise of coronavirus. It has been discovered that the new variant is 50 to 60% more transmissible compared to the old one. But either this is a new or old variant, I believe that we could still combat the virus. If we take this seriously and we all do our parts in following and abiding the mandates of the government, then we can eradicate, if not, at least lessen the occurrence. Just a gentle reminder, let us all follow these 4 major health protocols. Una, ugaling maghugas ng kamay, takpan ang ilong at bibig tuwing bumabahing at umuubo. Iwasang hawakan ang mata, bibig at ilong. Pangalawa, pagsuot ng face mask or face shield tuwing lalabas ng bahay. Pangatlo, observe social distancing. Keep your distance at least 2 meters. At panghuli, stay at home. Huwag lalabas ng bahay kung walang mahalagang pakay. Recently, we have just witnessed one of the highlights of the year in stopping this pandemic. In just few months, the vaccine was first introduced in this country that gave hope to us that perhaps a form of normality is within reach. Although there are loads of people who are hesitant to take the vaccine because of how fast the vaccine was approved and because of its possible side effects, I would like to highlight this. That because of the advancement in science, technology, and medicine, mankind was able to discover the vaccine in a very short period of time. I still believe that vaccine is better than no vaccine. I acknowledge that some people may have concerns regarding this vaccine or any vaccine for that matter. But I think it is important for us to be educated regarding the vaccination before making any decision whether to have or not to have the vaccine. Today, I have completed the 2 doses and I feel good and I feel that I can do my job better knowing that I have been vaccinated.
Assalamualaikum everyone. My name is Dr. Janelle Brian Arrebahet, a nursing professor here in Kingdom of Saudi Arabia. My pretty good friend asked me to talk about the updates of the virus here in the kingdom. I will not be discussing anymore the devastating or negative effects of the virus here in the country. Rather, I will be discussing the good news, especially this December. Number 1, Saudi health officials declared victory over the virus and said COVID-19 was under control. The kingdom's recovery rate is 97.4%. So far, the spread of the disease or the virus across the country is limited compared to the other countries. We are among the countries with noticeable control in decrease in cases. The kingdom has now more control over the pandemic. This achievement is due to the adherence of the people and community and health authorities to ensure everyone's health and safety. Number 2, vaccinations has started this December. Pfizer will supply millions of doses of vaccines until February 2021. Ages 16 and above are the targeted groups with the 2 doses of this vaccine. Number 3, entry ban here in the kingdom by land, air, and sea has been implemented and it will be extended until next week. This precautionary measure is against the new variant of COVID-19, which has been detected in many countries. This is my message to the viewers. No matter how much falls on us this pandemic, don't forget to be optimistic all the time. Congratulations, frontliners, you are the heroes of this crisis.
Narinig na natin ang mga mensahe ng ating mga kaibigan sa iba't ibang sulok ng mundo. And what do their messages have in common? That their situation is no different from our situation here in the Philippines. A lot of us are complaining about strict protocols and guidelines, pero may napapatunguhan ba ang pagrereklamo natin? Wala, di ba? We can complain, huff and puff all we want, but cases are still rising by thousands. not just here in the Philippines, but all over the world. Naririnig natin sa news, and some of our friends even mentioned it in their messages, that some countries fare better than others. But did you hear the part where they said that the country's success was because the government and their citizens were together? Kahit gaano pa kagaling ang isang gobyerno, kahit pa ang mga pinakamagagaling na doktor at scientist na ang gumagawa ng plano, kung walang kooperasyon ng mga mamamayan sa mga protocols at guidelines na pinapatupad nila, madadagdagan pa din ang kaso ng COVID-19 sa bayan natin. Kesyo mas madami silang pera, mas magaling ang gobyerno nila, mas, ang daming mas. Pero alam nyo ba na kahit wala tayong pera, makakatulong pa din tayo sa simpleng pag-comply sa mga minimum health standards like physical distancing, avoiding large crowds and parties, iwasang hawakan ng mga surfaces especially in public areas, proper hand washing, or hand rubbing with 70% alcohol, paggamit ng face mask at saka face shields, proper coughing and sneezing etiquette. At ang pinaka-importante, huwag magsinungaling, especially during contact tracing. I-report agad sa health facility pag may nararamdamang mga simptomas ng COVID-19. Karamihan sa mga to ay walang bayad. Kung meron man, sakripisyo sa ating mga bulsa. Napakalaking sakripisyo? Oo naman. But we will reap bigger benefits hopefully soon. Lahat naman tayo nagsasakripisyo, lalong-lalo na ang mga frontliners na nagsusugal araw-araw ng kanilang buhay para labanan ang pandemyang ito. Have you heard of the saying, we are all on the same boat? Maraming magdi-disagree dyan dahil hindi tayo nasa iisang bangka. Ang katunayan, we are in the same storm. At sa bagyong ito, may nakasakay sa mga yachts and ships while others are on rafts, boats, or canoes. Karamihan nga sa atin nakasakay sa gamit ng gulong na sasakyan. We are not on equal situations during this pandemic, but it is our duty to help out the best way we can. Madami na sa inyo ang nagsasawa na sa kakasabi namin sa inyo tungkol sa mga reminders na ito. Madalas naririnig namin na scam or pinagkakakitaan daw ng gobyerno o health sector ang pandemyang ito. Pero ganun pa man, we will never get tired of reminding you why this is very important. We should be extra careful at obligasyon natin sa sarili natin, sa pamilya natin at mga kaibigan natin at sa ating komunidad to help stop the spread of this virus by following the protocols and guidelines set by our government, who are also following guidelines set by doctors and scientists and other health professionals from international organizations like the World Health Organization and the Task Force for Global Health. The COVID-19 fight is far from over. Even with the vaccine, we don't see it ending very soon without the cooperation of the people. Lalo na nga may new variant na naman. Kailangan nating magtulungan. Let us do our part. My part may be small, but I start with me, and it will become bigger and more consequential because we do it all together. This pandemic is not a joke.
You can help.
We can all help.
Together, we can help.
We all can help.
For now, this virus is strong.
But we, together as people, we are stronger. God be with us all.
I would like to thank all of our friends who sent their messages. Thank you for sharing your opinions and point of views. We certainly learned a lot from you. And for those who also want to give their video message, don't hesitate to contact me. For details and instructions, like our Facebook page and message us via Messenger at Unleashed by Provincial Health Office of Ilocos Sur-IDU. Hope to hear from you guys soon. At sana naman may natutunan kayo sa episode na ito, at kung anuman kalaman ang ating natutunan, magandang ipamahagi din natin ang mga ito sa ating mga mahal sa buhay. Mag-iingat po tayo palagi. Lagi natin tatandaan ang mga minimum health standards, lalong-lalo na sa pandemyang ito. If you have any comments, questions, or suggestions, give us a message on our comment box down below. Don't forget to click that subscribe button, like, and ring our bell to get notifications of new Unleashed episodes. Happy New Year, everyone! Thank you for watching. Once again, this is your public health nurse, Tanya. See you on our next episode. Bye!